load it or upload the webinar onto our YouTube channel. So we're going to record the session. And I think let's kick it off. We're on 3 o'clock. So welcome everybody, and thanks for joining us another Wednesday, another Philotimo Let's Get Chatty session. And today we are very, what can I say? We are very proud and blessed to be joined once again by one of our favorite partnered institutions, the CANSA Association of South Africa. And joining us is the General Manager, ADELE Burgher. And we're chatting today about a topic that I think is quite relevant and something that I don't think we get to chat about often. We're going to chat about stoma care and wellness, a very interesting topic when I was going through some preparation for today, and Adele's going to share her presentation with us. And as we get people joining, we'll let them through. But I think with little introductions as we proceed from our side, the Making Philotimo Cancer Project, myself, EVY MICHALOPOULOS. I'm the founder and the CEO. Joining me today, John Kominos, fellow director and co-founder. And perhaps, Adele, if you're ready, we can hand over to you for a short intro. And then if anybody has any questions, please jot them down in the chat box. Or alternatively, we'll have a Q&A after the presentation. So Adele, handing over to you if you're ready. We've lost your...
She needs to unmute.
There we go. That's it.
You're back.
I've been on so many sessions today, you won't believe.
Wow.
Thank you for inviting Evie and everyone joining. I do appreciate. Today I would like to tell you more about our stoma care and ostomy journey that we have with all our patients and clients currently. So I've been with cancer now for 13 years. Still enjoying it, going strong. I'll probably go on pension, yeah, I say. So I'm going to share my screen. I'm going to start off with stoma, basically. So that is my portfolio at this moment within CANSA, is the National Manager for Stoma and Wellness. It's our employee wellness program, but that's something for another day. So let me quickly share with you.
Perfect, thank you. There we go.
Just want to enlarge it a bit.
That's it.
Okay. Are you ready? Let's start.
Yeah.
So basically with CANSA, we made the wise decision this year to have two main health campaigns, or two main health focuses for the year, which we now launched last month, which was our cervical cancer campaign. And then today, actually on World Health Day, which is the 7th of April, is now relaunching our colorectal cancer campaign, which goes hand in hand with our stoma care. So that's the reason why. And to share the great news today, we also launching for the first time in Kansas history a stoma virtual consultation line for patients in far-off places, but I'm going to explain to you more about that during the presentation and what it's all about. So while introducing these two great campaigns, CANSA would like to take hands with our patients on their ostomy journey, with making every step of the way sure that each step that is well thought through, they know exactly what to do, and the decisions are made within a team so that everything that's handled or problems that they encounter, CANSA would be able to assist where possible. We all know that it's important, a stoma patient, the impact that it has on them, having a stoma and what stoma is all about. So why would someone need a stoma? A lot of people, when I encounter people, they ask, but why do you get a stoma? So there's many reasons. Like I said this morning to someone else as well, everyone always thinks it's only through cancer. The most familiar one is more basically due to your bowel cancer, bladder cancers, inflammatory bowel diseases as well, like your Crohn's. But also, I've got one patient, for example, that I now specifically know personally, and he had a normal car accident, and it was like a concrete brick or something that came through the window, pierced his colon, and his stomach, and that's how he got his stoma. No cancer involved, but that's unfortunate, and he's got a permanent stoma for the rest of his life due to the accident. So there's many different ways, but our main ones are more through cancerous problems in the stomach and bowel, duodenum, and those places. So many colorectal cancer patients have a portion of their bowel and colon removed and then end up with a permanent stoma. And this is where cancer fits in. Although we don't only render a service to our cancer patients, but to all other stoma patients as well throughout the country. So it's not just cancerous patients, everyone. And that's sometimes when someone knocks on our door, they want to know, are you assisting us? Because there's just no help out there. It's really a concern. Stoma patients are not really looked after as they should be. Well, looking at colorectal cancer, the incidence is that colorectal cancer is one of the big 5 cancers within men. And when you look on this actual presentation now, you would see that it's listed as second biggest cancer, which is actually, when you look at today's our lifestyles, we like takeaways, healthy living is up and down, all depending on weekends and what's happening, alcohol use, tobacco use, and that's all factors that influence us getting colorectal cancer at the end of the day. And with females, well, same thing, and it's listed as number 3 under the top 5 cancers for females in South Africa currently. So cancer, we would like to take hands with each and every ostomy patient out there and help them with their journey with their stoma patient, with their stoma. We all know when hearing that words, you have to get a stoma or you have cancer, it is a huge shock. This will take time, and only with support, things will go back to normal. And this is where I would say cancer can really make a difference. So what is a stoma? When you look at the anatomy of your human body, your mouth, your nose, ears, that is, for example, a normal or natural stoma, a stomata. So any hollow organ in the body can be manipulated into artificial stoma as necessary. And this includes the stomach, duodenum, ileum, colon, pleural cavity, ureters, urinary bladders, and renal pelvis. So many colorectal cancer patients have a portion then removed of that specific area. And when they do the actual operation, they will cut through the abdominal wall, and they will then take out that part, for example, now the colon, and they will form it in it's like a flowery shape. When you look at the picture on here, you would see this is more or less an animated picture of what a stoma would look like. So each and every stoma is one of a kind. Stomas vary in size. They can be round, they can be protruding, they can be flat, inverted, and this is where it is so difficult to get a patient sorted. And you need expert advice. So stomas have many similarities though. Although stomas should be shiny, wet, it is not a sensitive area. A lot of people think it's painful and sore, but that's not the case. Although there are a lot of nerve endings, there's no nerve endings there, but there is many blood vessels, which can cause a bit of bleeding when rubbing too hard or when you irritate the skin or the area where the actual stoma is. Then there can be bleeding, but if the bleeding is prolonged, that's when we say, please make sure that you see your healthcare worker or go to your cancer stoma department. Okay, so this is now basically a picture of a colon that's been now made into a stoma. And then the stoma bag, you'll see there when with my arrow that's the base plate of your stoma. And this is the bag that is used by your stoma patient to remove and put back on, clean it out. And this is basically people, their toilet, actually, because remember, they can't pass urine or feces now through the normal ways as we should due to problems they had in the past. So you do get different types of stomas. A lot of people ask, now you get ileostomies and you get urostomies and colostomies, so what's the difference? So basically with the ileostomy, this is where they take the small intestine, which is called the ileum. They take it to the outside of the abdomen. This helps solid waste and gas to actually exit the body obviously through the stoma now, and avoiding or passing avoiding that the actual feces and gas to pass through the colon and rectum. So that's why they do a urostomy. That's all in the small intestine of the body. Then you do get a urostomy, which is also a surgical procedure that creates a stoma, which is always an artificial opening, remember, and for the urinary system. So, for example, someone has bladder cancer. That's usually the case when we do this. A urostomy is made to avail for urinary diversion in cases where drainage of urine through the bladder and urethra is not possible. And this is after extensive surgery in cases, for example, if there's obstruction as well. So usually with this type of stoma bag, there's a small, like a tap at the bottom of the bag where this person can now drain the urine and close the bag again as the day goes on. Because remember now, you can't put a new bag after each time you need to empty your bladder. It would be, yeah, just way too expensive. We will never afford it. A colostomy is a surgical procedure that's the same as the other two, but the difference is this is on the colon. So basically the colon is then diverted through incision in the abdominal wall, and we create a stoma. A stoma is an opening in the skin again, where the pouch collects the feces and it's attached. You get two types. You get a closed patch, a closed bag, or you get one with a base plate and a bag. So I think the next slide is the actual picture of it, just for interest's sake. This is a base plate on your left-hand side. Usually that base plate, that small hole that you see in there, they do cut it a bit bigger according to the size of the stoma, because the stoma size varies often. Within a month, with 3 days, 4 days, it changes. So this makes it available for the stoma patient to cut the base plate according to the size of the stoma. And we never want any urine or feces actually passing the base plate underneath the skin, because this is where skin irritation comes in, burning of the skin, bacterial infections, and numerous conditions. So the picture next to it is a colostomy bag. This is the drainable one for a patient that had a colon stoma done. So they will basically empty this bag of solid then obviously into the toilet. Some people clean it and reuse it again. Well, if you know what stoma product is, the cost of it now is just way so expensive, you won't believe. So it is important basically to clean these methods of doing it. And like I said, urostomy bags got a small tap on and then the urostomy as well. These two are closed with clips, the colostomy and urostomy bags. All right, so basically, what does CANSA offer to our stoma patients out there in SA? We are also planning to offer this service there now to all our African neighbor countries, also to other cancer associations within Africa. This is now our next step, basically. After today's virtual consultation line launch, then we would like to aim to help those in that countries as well that doesn't have access to any clinics or a care center. So now this virtual platform will assist them, and I'll explain to you how we do this. So basically, this is our Connect with Care telestoma support. We're launching it today. I'm very excited about it. We've got 8 stoma therapists that now offered their expertise service to us and say, okay, yes, we're willing. We're joining Cancer Association with this. This is an absolute free service. Now, if you know stoma, you would know that stoma therapists are they are so thinly spread in South Africa, you won't believe it. Probably on 2 hands, you'll count the amount of nurses we've got available on stoma therapy. It's not something that's done within our 4-year course when we do our degree in nursing. It is something that's just touched on. So usually this type of nurses go for extra training, which takes about 1.5 years for them to fully understand stoma. So with stoma care, this nurse would do her actual theory, and then we'll go on to practical work. And that's where the thing comes in. It's a lot of hours that they need to put in to actually get that qualification of being a stoma therapist. Now, this is the person that would do your first assessments, that would do your measuring where to actually put the stoma. So when the doctor, before he operates, he will actually take the point and say, okay, listen, you need to book an appointment with our therapist. That nurse will then do a marking for me on the stomach, which are taking in consideration the person's body structure, building faults, and we all know that we're not perfectly shaped. And when you bend over, you've got that bit of a fat roll, maybe. Some people, some don't. So that's where that nurse actually comes in, and she'll mark it with the X and measurements, so that when they put that stoma base plate on, it's never in an awkward place. And that's something that's not always happening now in our public health sector. The doctor just wheel them into theatre, they operate, and they put that stoma wherever they think is suitable. And usually with our largest stoma patients, they come out, and as soon as they sit up, that base plate just pops off. So this is where it's so important to make use of a stoma therapist. So what you can do now, if you know anyone with stoma, or you're a newly diagnosed stoma patient, then you can contact our help desk as the number on here. And with this help desk, you can arrange and make an appointment with a stoma therapist. And also, if you, unfortunately, we can only offer this to metro regions. If you stay close to a stoma therapist, which is in all our large metro regions, that nurse will actually do a home visit for you. She will actually do a first assessment, make sure what your needs are there any problems or any conditions of the skin, and she will recommend and do a prescription for you according to your needs. This is for medical aid and non-medical aid patients. So it's not just for those that can afford it, because it's free of charge. Unfortunately, the products that you need to buy would be, and there would be an expense to it. Yeah, it's something we can't offer at this stage. Otherwise, if you want more info, you can visit our website then on www.cansa.org.za. So what is the advantage of being part of the CANSA or CANSA Stoma family? We will offer this home-based care visits now, like I've mentioned, and also CANSA will be offering this expertise of 80 elite stoma therapists in the country, all our metro regions, but the virtual line would be there for everyone. So once an appointment is made with a stoma therapist, she will be in contact. She will do the initial assessment, give recommendations, and then if needed, she'll do a second visit again. Now, how is the virtual line going to work? Now, I'm going to explain to you. I had this patient in Vryburg. It was last month. She's been operated, I think, in late February. They sent her home. Unfortunately, she didn't have medical aid. She had to go to our public hospitals. She was sent home with 2 base plates and with 5 bags. Now, you would at least need about 15 bags, 10 to 15 bags for a month, and at least a base plate for every 4th day. So it just shows you that there's just no way she would have been able to cope with the amount that they've given her. No real advice given, send home. So that's when we actually tested our virtual line. So what we've done is, the only method of her communicating to us was through a WhatsApp. I contacted on a WhatsApp call, and we had a video call. So basically, they would take off the stoma, clean it. She will situate the phone in a way that I can see what she's doing, and we work the whole procedure through. So that's where our virtual line really comes in handy for those that can't afford to go to a cancer care center or to a clinic then, or a stoma therapist. So yeah, that's actually in a nutshell what we do at the stoma department. So we offer counseling, support to their families, to the stoma patient as well. We stock all major brands of stoma products at really affordable prices, and we deliver to your doorstep. And CANSA will assist with claiming from medical aid. We'll help with the authorizations as well, and we will write you a motivational letter and also give a motivational script with the products that you need. I've completed my dispensing license so that we can now issue a script to a patient so that they don't have to go elsewhere and first get a script and pay a fee there to see a doctor or another nurse or a stoma therapist. So we've made that service available as well. Okay, so basically, and the good news for today, I think this has been wonderful for me to share. As part of our 90th anniversary, CANSA was in the fortunate position now to be one of the selected NGOs to receive a donation stock to assist those in need. So we received donation stock to assist 90 patients with financial constraints and without medical aid. So we urge everyone in the community that knows a stoma patient or one that's really struggling, please let them write me a letter. Tell their ostomy story to me or to our stoma staff, and we will help where possible, and we'll definitely do it until stock lasts, obviously. But we regularly get stoma products on donation, so we always do try and have donation stock available. But this would now be the first time that we would be able to assist a stoma patient for a year, 90 patients at least. Yeah. So, sorry, Evie?
I said, that's amazing. That's wow.
Yeah, that's really what was really good news. And just a word of thanks, then obviously our two partners that made that Convatec, they issued us with this. Also, thank you to the Me Plus program that we're going to launch later in the year. It's going to be an app for our stoma patients. So they will be able to go onto our website, click on the link, and on that app, you can ask any type of question. Even have a look at a video. Say, for example, you've got a stoma and it's a leaking stoma. What should I do? You can just type in the question there, and the app will direct you more or less in a direction according to previously asked questions. Yes, and that is my story on stoma. It's not a large presentation, but that's basically the service that we render from stoma. Thank you.
Thank you, Adele. That's very informative, and well done on the 90 donations that you're able to assist with.
Yes, that's great. We're so grateful.
and yeah, you know, as you said, it's something that we need to reach out into the community and
yes,
make those people aware that are currently, you know, having to live and deal with stoma and in need of, number one, counseling, as you said, number two, advice, and number three, product. You know, so those are the huge challenges of getting that information out there. But hopefully through our webinars and our presentations, we are able to get the word out. And of course, stoma, you know, originally when I was looking at the definitions of it, it comes from the Greek word, you know, which is stoma, which is the mouth, and it's literally an opening.
Okay.
Through your presentation, it now all makes sense and flows together. So
okay, that's great.
Yeah. Let's just see if there might be any questions that we might need to answer. Anybody have a question for Adele at this point in time?
Just one. Adele, sorry, I might have missed this in your first slide. Do stomas also occur in patients that don't have cancer?
Yeah, well, I think that's our first slide. Usually, it's not only from cancer that you can get it. You can get it from Crohn's, the diverticulitis you can get it from, and also accidents, like a normal accident, like I've explained to them. Had a car accident, punctured the colon, abdomen, and that's also ways of you getting a stoma at the end of the day. Yes.
Yeah. Okay. Thanks.
Adele.
Okay.
Adele,
yes.
Thank you for the presentation. There's a huge stigma attached to people with stoma. Most people don't understand it. It's a dirty word. Can you? And I know you've mentioned that you have counselors who will engage with not only the patient himself, but obviously the family members who I think are affected really badly as a result of this. How do we avoid the stigma? How do we make this something to discuss openly in public without feeling like, you know, you've done something wrong or you're about to injure someone's feelings?
I think the most important thing is to deal with the patient's emotional side first. Let him deal with it, because as soon as they accept what happened and what they are, then they will go out and speak more openly about this. Usually with our stoma patients, they tend to hide it. They're very shy. They don't want to go to public places. They don't want to do sports anymore. And this is where we want to come in and say, listen, it's okay. You've got a second chance in life. So go on, live it. So with our app that we're going to launch later during the year, there's specifically things on how to cope with your everyday life. Doing sports, this is what to do. If you need to swim, we've got now a cap that we've developed, actually, our suppliers, which you can put on, you can take your bag off, and it's not that visible to other people. But it's important then that the family members should definitely get counseling as well on this. Understand what a stoma is all about. What happens if gas is passed? And what happens if the actual bag gets bloated? All that type of things, and which is embarrassing to a stoma patient. Yes. But as soon as that we can get them to accept what happened to their body, the better it would be out there. I would definitely recommend a stoma patient to see a stoma therapist. She would also help with the counseling and dealing of this trauma. And then also our counseling line with our social workers that's available, doing counseling, and our nurses, and also available. And then family members should definitely contact our counseling line or see someone that can counsel them on this, because it's still a traumatic experience for the family as for the patient.
Thanks, Adele. I see we've had a question come through. How do you get through to the older generation so that they speak up about having a stoma?
I must say, sometimes I think when not having a stoma, they tend to keep quiet. But as soon as they get more comfortable with their situation, they actually start speaking up. I've got a few older patients currently that they are willing to give advice to other new stoma patients. And they're actually quite eager to share their experiences. So I think the more awareness we can create, it would definitely help our older generation. Awareness. And I think this is what this colorectal cancer campaign is all about this year, is to create more awareness, especially for everyone out there not having stomas as well. Because we never know when this is put along your path. And always to support our fellow human beings on what we all experience out there. So our older generation at this time, our current patients are really they're going the extra mile, helping other patients and assisting where possible. And they don't even try. They pull up the shirt, show, this is what I do. No, buy yourself this. You'll see it works amazing. And sometimes it's usually the spouse that's actually more comfortable with this. They're usually the ones that shows off the stoma and what an excellent job they are doing, fixing and helping with the stoma, because usually it's where the spouse is really involved in the stoma patient's life at this moment. Yeah.
Thanks, Adele. Thanks for that.
And can I?
Go ahead, Loretta.
Can I go ahead? Okay. So I just wanted to find out, Adele, thank you so much for the presentation. I just wanted to find out actually. So we don't, well, in South Africa, that is, having a stoma is not regarded as a disability. Is that correct?
Well,
because I
no,
think from a Canada side, it is regarded as labeled as a disability, and then you obviously, so I'm talking specifically from, if I have to go use the toilet, for instance, the public toilet,
yes.
Then because it's wider, it's bigger, I would want to use the disabled, but you would then have to kind of produce something or prove that you're disabled. So
yes,
I don't know, how is it regarded as? Is it regarded as disabled or not in South Africa?
Well, at this moment, we definitely added this to our advocacy role for this year, because when you look at for country or states like Europe and those places, they actually get like a passport from the transport and transportation departments, which actually gives you access to going to skip public toilets. They actually have their own toilets, their public toilets, just for stoma patients. So that's something that we're way behind. I don't see in the near future that we'll have that luxury. But what we now suggest, and we're going to launch it in May, is we're going to have a passport. Create like a small CANSA passport. On it will be able for you or the stoma patient to produce this at your airport as well. Say, for example, you're traveling and you're now walking through the examination area. You don't have to pick up your shirt. This is what you're seeing on the actual screen. You can show your passport, and on that passport, it will actually explain to you, this is I'm a stoma patient. This is the matter. And it will not to be examined before everyone and being exposed to that situation. So we also would like to, that's where our advocacy team will come in. They are going to advocate for this strongly. We also have this passport available for public places. and get all the big malls on board. And say, for example, have a sign set up there. If someone do produce a passport, please allow them first in the queue to go and empty that bag. Because we all know if that bag really gets full or there's a leak, you immediately want to go. You can't stand in a queue and wait for someone else. This is an emergency situation for you. So that's what we would like to get the word out there. And this is, again, people where we say awareness is so important. We need to get malls on board, even departments, take it to government to make sure that this is something that we be the voice for the voiceless people on this matter.
Fair enough. Thank you.
Yeah. Thanks.
Okay.
Thank you. And Adele, we were talking earlier about how to reach out to the older generation. And I think a question that I have is, I had a referral that came through the project, but it involved a younger child who's since I think he was in maybe like 7, 8 years old. He's now 13, 14.
Okay.
And, I guess my question is the challenges that come with children being in a situation where they have to have a stoma. And this particular referral went through the process, and he's been bullied 90% of his time at school. And how does this affect children having to be in this process psychologically, mentally and physically, in terms of, in a situation where they have to have the stoma placed? How do we encourage those kids? And, and I know it's always difficult because you can never prevent bullying in a situation always that takes place, but how can we encourage people to look at it from a different point of view? Because that individual, that child, is having to cope with not only its own illness, but also take on the challenges every day of being bullied about the fact that with him, and it's a double sort of dose of trying to deal with, going through your journey and your path. What are your thoughts?
I think we all know how children are, unfortunately, and just bullying going on now in schools is just difficult to handle already. Not just even to say if you've got a stoma, which even makes it worse. So the first thing that I would suggest, if any child has ever been diagnosed or getting a stoma, we've got a few children already that is patients of ours. We've got actually a boy that had his stoma from the age of 10 months. So he's now 4 years old, staying in Free State, Bloemfontein. And he's coping very well, but obviously he's not there yet. So when you get to that primary school and high school, bullying taking place, I think it is very important from an early stage to create, obviously, awareness, like I've said. Schools as well. I think it's an important thing that we should do this. And it is a difficult situation currently, I think, all over the world. So I would say with a child, it is very important from day one to have a counseling and a regular someone to speak to, and also a stoma therapist that would be able to adjust or help that patient or child to have the best products according to his or her needs. So if it's a very active child or a very child that's doing a lot of sports, it is important to look at the bag that they need to use. This will limit their exposure to being humiliated as well if we have proper fitting products for that child then. So, for example, when we look at irrigation systems, this is something totally else which is really used in Europe, but not in our country as yet. And our surgeons don't go out and recommend it. They just do the stoma and pass it on to us. So basically, there's an irrigation method as well, which is for colon specifically, where you actually wash the bowel inside. You do it in the toilet, and it's a procedure where you don't have to wear a bag afterwards. You just put a small cap on, and it's literally, if you can look at the size of my hand, that's the size of the cap that you put on the stoma. So no one would really see that bag as well, or that cap, if you can do irrigation. But that's a method that should be discussed with the parents and with the child, and it would help them to lead a more active lifestyle, definitely. Because kids still want to swim, they want to run outside, they want to jump over stuff. So it would be your best option. And then obviously, if they can't do the irrigation and they don't really get right with that, I would then just suggest always make use of proper underwear. Now, CANSA has got a memorandum of understanding with a new partnership that came on board. She supplies us, or you can order your underwear for stoma patients, and it's actually the first in the country though. And inside the actual underwear, there's a small pocket where your stoma bag fits in. So, and it comes up to the middle of past your navel, and then it actually fits the bag nice in there. So if something leaks, it's in the actual underwear, and you'll still have time to get to the toilet in time before it actually leaks out. That company that's actually manufacturing it for us, it's from Mauritius, and the lady is in South Africa, and it's Vera SA is her company's name.
Yeah, that's awesome. I'm actually testing them. I've just bought one recently, so quite amazing.
Okay, and how do you experience it? It would be good to know from someone.
Yeah, no, it's definitely fine. I'm actually enjoying it. Very discreet as well. The only thing which I actually don't like is the pancaking, but I mean, there's no way you can get away from it, you know. Sorry about the noise outside. It's you can really get away from that. It's either you want something over it and you will get a pancake, but
that's a thing.
It's actually quite discreet, you know.
Yeah, that's a thing. No, so Lerato, now that you mentioned that you are a stoma patient as well, remember after this session, send me your email address. I will definitely make sure you receive one of that passports that we're going to create. It's going to be with our CANSA logo on everything, and hopefully it will open some doors for you in the future. Okay.
Thank you so much.
That's awesome. And Adele, talking a little bit about dealing with having the stoma and how it's going to change your lifestyle, obviously from where you were before and now where you're going through a different journey whilst you're through the process, whether it's permanent or semi-permanent. Your lifestyle in terms, we've spoken about swimming and bathing, perhaps a little bit about diet and nutrition. So someone that's just had this process done, does their diet have to change completely? What should they avoid? Just a little bit of advice in terms of that area.
I think the first advice would be usually give a patient when obviously receiving their first stoma. And I think a lot of people will differ, because I've heard stoma therapists say you don't have to make any changes to your diet. But I would say, yes, I agree. And there's stoma patients as well that said they didn't change. Some of them had to change. So it all depends on your body. So I always say when having your stoma, being discharged from hospital, slowly introduce foods to the body and then see how your stoma reacts on it. Gas-forming products or gas-forming food, at first avoid it, see what's happening, and then one by one introduce. Don't introduce just a whole meal filled with things that you didn't have before at first, and then see how your body reacts. This way, you would also be able to see, okay, when I'm traveling, I know I need to avoid these foods. When I go out in public places or doing sports, don't use this type of foods. I had, for example, a lady that couldn't take any lactose products. She got a very runny tummy from it, so her stomach bag was just watery all the time. She can only use certain yogurts then, obviously, in future. And then there's a lot of people would say red meat. There's things that dissolves easily as well, is more appropriate for a stoma. But then again, we do have patients that know how to regulate their stomachs in such a way that they know exactly what to eat. We've got a travel, she's like a travel agent, also traveling the world, taking tours everywhere. She flies from one point to the other, real jet setter. She's got a stoma as well, and she makes use of the irrigation system. And she knows exactly, if I've irrigated my bowel today, it takes her this amount of hours before I need to irrigate again. But she knows her food types, which is important, what's working with her body, and obviously if she's going to get bloated or not, and what's causing it. Well, I actually laughed when I asked her, can you have a normal diet? How do you experience it? And he said, you know what, I can still have a G&T and I'm fine. So he just shows you can definitely have a normal life. It all depends on the way you look at things and how you experience it, and make the best of your second chance that you've got.
That's really important. Yeah. And I think you've touched on so many other different aspects, and we've got a couple of questions.
Okay.
We've spoken about swimming. I have a question that says, can you shower with a stoma bag off? And how often should you change your stoma bag? I think you touched a little bit about how often we should, but perhaps if we can just answer whether you can shower with a stoma bag off.
I think we always say we try and protect the skin around the stoma and also the stoma. Or remember, we wipe it, shower, it would be fine. I don't want someone to lay in a bath and with an open stoma. Don't do it, avoid it. But you can definitely shower. It's clean water running from your body, but obviously don't wash your upper body and then let all the soap run through the stoma. We don't actually want it. So we try and cover most of or obviously wash and then take off the stoma back and then wash that area and then get out of the shower. So avoid the soaps and stuff going to the stoma area. We don't want strong soaps. On the actual stoma, gentle wiping when cleaning the stoma as well. Even the skin, you need to handle it with care. The skin where the base plate needs to stick to. If there becomes a small tear in it, or you break it, or there's an infection, it just makes your life miserable. Getting that base plate to stick and having a skin infection, we need to avoid it at all times. So possibly, if you can avoid, don't shower and wash your whole body and let all the water run through the stoma or on the stoma. Rather take off the bag, wash the rest of your body, clean water, and then that's it. You can get out of the shower again. Preferably not lying in a bath with an open stoma. No, I won't suggest it from my side.
Thanks, Adele. And you touched a little bit about infection. I think that was my next question. Can a stoma get infected? And if so, how can you tell if a stoma is infected and what can help with irritated skin?
Yeah, there's different methods, and it all depends on, it's like the stoma therapist actually told me that the other day, it all depends on that person. It is important to look after the skin. So obviously you can get a lot of skin infections, bacterial infections, fungal infections on the skin, but it's always important as soon as you see something. That's why now we have this virtual consultation line. You can immediately contact the stoma therapist and say, listen, I've got this on my skin. You'll take a picture for us, send it to us, and we'll immediately see what is it. Is it just a normal skin irritation? Is it a fungal or bacterial infection? What to do? And then obviously we always say clean it with water, and make use of all the accessories that they do supply if possible, if you can afford it as well. Make use of accessories because this protects your skin from leaking, urine, feces, anything that goes underneath onto the skin, and that can burn the skin at the end of the day. So there is different treatment options and different methods to use, but it all depends on your problem that you're experiencing. The stoma therapist would be able to assist with this. And also, if she would suggest antibiotic, that would also be given by the stoma therapist on a script for you to say, okay, this is what you need, and you don't have to go to a doctor now still for that examination and pay for it.
Okay, that's awesome. Adele, another question I have, which runs into two questions. One, starting off to say, what can go wrong with a stoma? And what are the three major problems associated with having a stoma?
I think, maybe to agree, I think, Loretta, you would say leaks are the major concern. And then obviously skin infections is also a big concern for us. That's our two major things that I would say it's a problem. And obviously, I would say thirdly, if your product doesn't fit properly, or it's not a nice fit, that is also a huge concern. So those three are my top problems that we would say we experience. So it is important to get expert advice on what product to use that fits your body type as well. Is it a protruding stoma? Is it inverted stoma? What to do and how to make sure that all the urine and feces do get out the way it's supposed to be and not leaking. Leaking is always a concern. I actually said with this virtual, when we thought of this virtual line, in December over Christmas time, we had a patient late night. I think I received a messenger, actually a messenger on Facebook. She's got a leak and she can't get rid of it. And obviously it is public holidays. There's no one to assist. and then you have to try and help over the phone. And I thought to myself, why not? We can always see if we can't assist on the phone. At least there's someone there that can assist for you on Christmas Eve. I'm got a leak and it's 3 days now. What am I going to do? I only have one bag left. Shops are not opening. So where am I going to get another bag? So these are all things going through their mind. And that's where we want to step in and see how we can assist. So Evie, to answer your question, it's definitely those three for me. I would say concerns.
And then maybe I wanted to add the blockage as well.
Yes.
That's another thing that, that people struggle with. I know I've struggled with it myself. So.
Okay, yeah.
Adele, how important is it to remain properly hydrated? Because I've read somewhere that, you know, if you, because of the amount of volume that's going through the stoma, it could dehydration. Is that true?
That's definitely, hydration is key, definitely. Remember, our body uses water or any method of hydration to clean the system and also to clean your bowels, urinary tract, kidneys. So if we put in more moisture, obviously it would be easier. It will help with blockages as well, or prevent it from occurring. Not always the case, but hydration is definitely a major concern. We need to make sure hot, warm days as well, make sure enough water. I always say, people say, no, I can have a cold drink still, it's still a fluid. I believe water is your best cleaning method of cleaning the bowel.
Do you find in your experience that people are actually afraid to drink a lot because they're afraid of having to deal with the stoma?
More. I think especially with urostomy patients, they would definitely try to avoid it because otherwise they need to clean the bag, you know, continuously or empty it. So, but I think that's definitely a problem. People don't want to, but I think if they do get the proper expert advice, they would see the necessity into it. Why should I drink more water? Obviously, more water also helps with a healthier skin. And the skin is our biggest organ in our body, and that base plate needs to stick to the skin. So again, water has multiple functions.
Right. Thank you.
Another question I've got is somebody asked, what does it mean when the stoma is purple or turns black?
Well, you can have a strangulated stoma. That's usually when a product doesn't fit well or the hole is not cut big enough. And then it actually strangulates the stoma. The hole is too small. And that is very dangerous as well. It's almost like if I can call it a gangrene of the stoma. And that stoma can basically die off at that end. So as soon as there's a change in color, always seek expert advice on that and get that solved before it really becomes a problem. And they need to redo or do another operation and do another stoma for you. So it's important always, if you see that, it can be strangulation, it can be other factors as well, but definitely seek medical advice.
So Adele, is it more important, so obviously if color changes, but is there a difference between it being black or purple, or is it just, as you say, you notice a change in color, make contact and go and have it looked out? Okay.
Yeah, definitely, And blockage can also have an effect on it, obviously. Strangulation, our huge concern, because you are so afraid that the leak will go through to the skin that they actually cut the hole very small. They don't want to cut it too big because they're afraid that might be exposed to the skin, the waste matter, and that's where this comes in. It's too close to the actual rim of the stoma, and this is what happens then. People being afraid of the leak, then cutting the ring too small.
And let's talk a little bit about costs. So obviously somebody that might be listening to the webinar at a later stage, knowing that they're going to have this procedure. Adele, just roughly, what are the costs, if you can perhaps give us some info in terms of getting these products, getting the stoma bag, the patches, the base plates, and is it something that's covered through medical aid that you can claim on, or is it something that you have to purchase out of medical aid, etc., etc.?
Okay, basically the cost will be different for each and every client. It all depends on what they're using. if you're in the privileged position to have a medical aid, whereby we will assist and help to motivate you getting your authorization for your products. Usually the medical aid gives us a few months authorization, and we will be able to issue you with the products then on a monthly basis. We'll put in the claim as well. But there, from the base plate, there can be base plate, there's adhesive, there's barrier wipes, and there is removal wipes and all those type of things. There's barrier paste that we can put on as well, barrier rings. There's different types of stoma bags and base plates that you can use depending on your type of stoma. So it is a huge cost. I think it's a huge cost, especially if someone can't afford it. And it is a very precious thing to them, a stoma bag. You don't want to waste one stoma bag, because you know each and every stoma bag is one less you don't have anymore. And you always need to work out, is there enough stoma, or are there enough stoma bags left till the end of the month? So they always need to do that calculation in their head. And if something happened, or they had an oops, or there's something, or the skin, or there was a leak, that's always a matter to consider as well. So we always try and see if we can't get a bit more stoma stock to the client for that odd occasions when this happens. Yes, so when looking at a stoma, it can vary between 1,000 to 1,005, 2,000 Rand, depending on what product you're using. And I think this is where it comes in, where our public health sector just don't always gives the amount that they should to our patients. We had patients in the past that really can't afford this, that we actually, and I think I see Olivia's on this webinar as well. She knows about this patient that we had years ago, and she couldn't afford stoma bags and base plates, people. So what she basically did is she stuck a piece of checkers bag to her body with plaster, and then she'll make use of a belt to keep that checkers bag in place. So she had to make a plan to get this. But just imagine yourself now going through this experience, making use of this type of things when it's available actually. And that's why I say it's very important awareness and getting the health sectors up to par, making sure that they do deliver, because costs are expensive. Yeah. And the more, if you do experience a bit of problems, you'll have to get more different types of products then. For example, there might be an autophase ointment that you need to put on, or there should be powder that you can put on as well for this problem. So it's always to have a nice kit and degree with your basics in it. For example, you would know, would it help for my body? Is it not helping? I need a powder in it. I need a paste. Should I have a barrier tape for it? Different bags as well. And now at our stoma department, we've got a small bag as well, like an intro kit. In this bag, you'll get a scissor as well, with also your red bag for your waste that you want to put in. You need to throw it away. So this is actually all things that costs money, unfortunately. Yes.
And Adele, all the that you've mentioned are available at CANSA or online?
Yes, you can order all the consumables is orderable at our CANSA Stoma Clinics, which is in Pretoria, and other main one is in Cape Town. But yeah, you can just mail me as well, and we'll also assist.
Thank you. Anybody have another last question or something to ask Adele before we close off?
Just one last. Yes, Bobby, you can go.
No, sorry, I just wanted to tell Adele she's got to rehearse this thing properly, because she's going to be talking a lot more this month.
That's good, Bobby. I'll do so.
Yeah. Adele, I just wanted to find out in terms of the fumes that comes from the bag, right?
Yeah.
Have you come across, any ways of like just getting rid of that?
Yeah, that is a problem.
I'm not sure what product. I know there's a product that they use overseas, but I mean, shipping it over is a problem and a half. So I don't know in South Africa if you've ever come across something like that, because I think more than anything, we are very conscious around, can you smell it? So was it just me,
Yeah. I don't know, Loretta, have you tried the Diamonds product already or not yet?
No, so I'm fairly new, right?
Okay.
I received mine last year, October. I mean, August.
Is it?
Sorry. Yeah.
Okay, so this webinar was just in time.
Perfect.
Okay, so basically you get different sprays, obviously, that you can keep in your bag. As soon as you spray, it eliminates the smell around you, and I think you know about this. But then you also get a product from Convatec, which is a diamond. They call it diamonds. It's in a like a small shiny bag, basically. And you put this in your empty stoma bag before, when you clean out and you put a new bag on, you just put this small bag into the stoma bag. And that one actually, as soon as there's any feces or urine coming in contact with that actual sachet, it will open and it actually solidifies everything in it. And it helps with the smell because it is charcoal in as well. And it just makes it much more easier to actually handle. But it's all considered a luxury product, but it is really excellent. And also what's really nice about it, as soon as you put it in the bag, it helps with smell. It helps to actually keep it as a
solid,
it's a solid, so, and that there's no leaks coming out, and it prevents the leak coming out, obviously, like I mentioned now. But it's also easier to empty because it keeps everything together. When you test it and you put it in a glass of water, it's actually you can turn the glass around. You can see that it's not going anywhere. Nice. So it is really nice. It's called diamonds from Convatec.
Yeah. Okay. Thank you.
Awesome. But we do have stock at the stoma department. We've got stock.
Starting order from you.
Yes, definitely. You're more than welcome.
Fantastic.
Adele, so can we just repeat that then? The stoma stores, you said the Cape Town and Pretoria care centers. Is that where you've got?
Yes.
Okay.
Yeah, you can put your order in there. We will deliver nationwide via couriers. And if you don't want a courier to come and actually deliver it to your doorstep, you can also collect it at depots throughout the country. We've got a few depots left still. We've got one in Durban. We've got a depot in Pietermaritzburg, one in Roodepoort, Bloemfontein. East London will also have a depot, Cape Town, and George. They will also have depots, Kimberley as well. So all depends on where you want to ship. We would say we'll help where possible. And if you don't want to deliver it by your home or at your workplace, we will make a plan where you can actually get it. A nice other option as well is that we've suggested to people in far off regions is to have a delivery at your PEP stores. There's always in the smaller Karoo towns, there's always a PEP. I don't know if you've seen when driving, but they also take delivery of our stoma products. So you can collect it there with just your phone number and your ID. Then you can collect your stoma products from there as well. So there's different methods. Just to mention, Evie, we've seen in the past that people they don't want others to know about the stoma. And I've got a specific a male in Joburg, hired in a corporate position, and he refuses us to deliver any stock. He doesn't want it at his home, nowhere. And when he collects his bags, there shouldn't be a name on it as well, or anything that actually can link him to a stoma. So it is unfortunately sad, but he's really not coming to terms with it. But it's been for years like this, so he's very private on this. And then, believe it or not, there's one of our old super sport presenters currently on TV still, also with a stoma. He's a sports person. He orders his stock from us, but he is open and he will talk about it. So no problem for him. So this is something that happens so often. We don't really realize how many stoma people there's out there. Yeah.
Adele, do you want to drop the name of the sports person? And I'll tell you why. So I hike, right? And I do multi-day hikes and all that. So I always want to see how sport people actually, react and how they are, based on me having a stoma. I'm out there for 5 days out in the mountain. How am I gonna, I think the challenge the challenge with me is I've got a backpack. These disposables are not really biodegradable, so you kind of carry this with
you need to carry it with you
the next 5 days. Is so uncomfortable, but kind of my community knows about it. I think for me to accept it was quite talk about it, and then then it's easier to accept. So yeah.
And sometimes they accept before you even do, isn't
exactly.
it? Yeah.
Exactly. So yeah.
To be honest, Lerato, I can't really in a position to give you his name.
That's fine. That's fine.
Yeah, I want to protect his privacy as well. But they on the Me Plus program, if you now send me a mail afterwards, I'll send you the link to it. On that program, there's a lot of I've seen hikers on there as well, and also names of people that's been hiking and how they experience everyday life. So maybe you can send out a mail to them.
Nice.
And then, I think you can get some help there.
Thanks.
That's awesome. Thank you. And Adele, anybody got a last question before we close off? No? We're all done?
I'm just going to put on my email address again, for Lerato, or someone else needs it.
Yes, please.
So then you can just mail me directly and I will sort whatever the concern is. Or I'll find out for you, Lerato. I'll help you and see what other stoma therapists say and what is the best products there is out there. And also, I don't know if you know about the remoldable stoma products that you don't have to cut with a scissor. I don't know if you know about it. It is an excellent product that's now newly launched with Convatec as well. And basically now when you've got that base plate, it's got a small hole in the middle. And actually now you form the hole with your hand. So you can actually mold it. You don't have to cut. So if the size changes, you can just mold according to your needs. It's an excellent product, especially for people that's active.
Yeah, the challenge becomes where, you are a new stoma patient and then whatever product is told to you at that point, kind of you stick to that. So I was introduced to Coloplast and I've been with them and I've never really looked elsewhere. So I don't know what is out there. Hence,
there's a lot of products out there. Yeah, we've got Hollister, we've got Convatec. There's a lot of products. We always try and see what suits your needs. And you can just say, okay, this is my problems. How can I solve it? And we'll see what we can do for you, definitely.
That's awesome. And I think just in closing, CANSA has wonderful fact sheets available online for downloading, stoma and stoma care fact sheets, as well as nutritional guidelines for individuals. So please go and have a look at their website. If I'm not mistaken, you've got your website as CANSA, CANSA.org.za. Please go and have a look.
That's correct.
Very, very informative fact sheets. And again, Adele's contact details have been shared. We'll also share them again on our platform once we upload the webinar onto our YouTube channel. And if anybody has a question, please feel free to SMS us, email us. We'll get them through to Adele at CANSA and she will assist you. So opened my eyes, Adele, to a whole new world. I must tell you, I now get to understand a whole different side of stoma and everything that comes with it. Completely open-minded in terms of the psychological, emotional, and physical, process that goes with it, which is, I think, as we chatted earlier, our aim is to get this information out there and get people to know about it, get people to make contact with you for assistance, for products, and for counseling, and especially your virtual, which is what you mentioned, virtual consultations to help them through their journey. So once again, guys, everybody from CANSA, well done. Keep doing the amazing work that you guys are doing. You are assisting so many individuals and people out there that need your help. We are very proud to be associated with you. And in closing, I'd like to also thank our partner institution, BMW Bryanston, who are proudly sponsoring this webinar. So shout out to the BMW Bryanston team.
Thank you.
In closing, John, anything from your side before we end?
No, thank you very, very much, Adele. I think, during my journey with the Philotomo Cancer Project, I think this has been one of the most difficult for me to understand and work with. I just have so much empathy. And Lerato, you're an absolute champion. Evie's going to send you information. We want you as one of our champions. You're amazing. The way you carry yourself, it's really admirable. And we really appreciate you in the time. So thank you all for your time. We really appreciate it. Olivia, lovely seeing you. Thank you for joining us.
Nice seeing you.
And thank you once again to Adele for your time and giving us this very informative session. Next week, Wednesday, another webinar planned. So keep a lookout. We're going to have an interesting topic again to chat about. But please Feel free to share our link on the YouTube channel. We'll upload it. And any questions, as we said, we'll get them through to you as soon as possible. But other than that, from our side, love, lots of strength, lots of blessing. Please stay safe, everybody. And Adele,
thank you.
We'll chat soon. Thank you again.
No, definitely. Lerato, pop me a mail will help. And thank you for everyone for listening.
Thank you so much, everyone.
Thank you. Bye. Bye.
Bye.
Bye.
Bye.